Welcome to Big Butts No Lies. I'm Mavi, your go-to guide for everything plastic surgery. With 18 years in the industry working alongside top board-certified plastic surgeons, I know what really goes down: the good, the bad, and the botched. Now I work for you, bringing you real, unbiased info to help you make the best choices for your dream look. Whether you're going for subtle enhancements or a full-on transformation, I'm here to give you the facts, the tips, and the confidence to navigate your surgery journey. Let's get into it. Should be fun. Hey guys, do I have the show for you today? As promised, I'm bringing you plastic surgeons from across the country that can help you achieve the look of your dreams. And today, I am super excited to have Dr. David Kashan, a Cleveland-trained plastic surgeon out of New York, on the show. Thank you for being on the show, Dr. Kashan.
Of course, my pleasure. Thank you for having me. Hi, everyone. I'm really looking forward to this. I'm really excited about this. I'm glad we got to make this happen.
Yes, you guys are in for a treat today because we are going to deep dive into something that has gained a lot of popularity, and I feel it's the future of facial aesthetics. And there's a lot of information, but I want to really get into it. And you guys, today's topic is facial fat grafting. Hey. Woo! So, Dr. Kashan, let's talk about facial fat grafting. For our listeners, let's talk them through the different options that they have when they start noticing volume loss in their face.
Okay, great question. So, if we're going from, I will call it least invasive to more invasive, obviously when you're talking about volume loss, the thing everyone knows about are the hyaluronic acid fillers, your Juvederms, RHA, Restylane, stuff like that, things that are reversible. If you're going a step up from that, you kind of have your pseudo permanent fillers that people use in the face, and then you have your biostimulators like Sculptra. I've kind of, in my practice at least, have bypassed most of that, because the problem with it is I find them to be a little bit more unpredictable, because you're really the goal is to see what the body comes up with, especially when you're talking about the biostimulators, right? You don't know what the final result is necessarily going to look like. With filler, you have a little bit more control over it because it's a more of a immediate response. So for me personally, a lot of patients come in and they say the same thing, like, I hate that I have to come back in every 3, 4, 5, 6 months to keep getting filler, to re-up on it. There has to be something better that's also natural, right? That's been the kind of push. I want more natural. Anyway, for a lot of our facelifts and any facial surgeries we were doing a lot of facial fat grafting. So to me, it was a natural progression to start introducing that to those patients that say, hey, I don't want 5, 6, 7 syringes of filler in my face. It's starting to rack up quite the bill. How can we do this and still get long-lasting results where it's not going to damage any future plans I have? For example, a future facelift, eyelid surgery, things along those lines.
I have a question for you.
Mm-hmm.
A while back, there was a viral video that went around showing an MRI of a patient that had years and years of old filler. I want to hear your thoughts.
I can't agree with it more in that I think the problem is that people don't realize that filler is lasting longer. Yes, it is a hyaluronic acid, and yes, they are theoretically using absorbable fillers. Where I've really noticed it the most without fail is under eye filler. Patients that have had filler 5, 10 years ago come in and they're talking about how they have this bulging under their eyes and this bluish discoloration. And I asked them, have you ever had fillers there? And they said, oh, I did, but 10 years ago. I put a little flashlight on it. I see that there's fillers in there. I check to make sure that it's actually filler. We reverse it. And they're like, wow, I can't believe that there was still that much left in there. And to me, the primary reason for that is, especially with the under eye, is the skin is so thin, the lymphatics are so susceptible to pressure, so they're not draining as well in that area. So the filler just can't get cleared, and it just sits there. And what it's doing is it's chronically damaging that skin until you finally get it out. So you're hoping that you remove it fast enough where it hasn't caused any permanent damage.
I actually totally agree with that. I'm not a huge fan of under eye filler. I prefer facial fat grafting for that. And so for a patient, let's have our imaginary patient. I like for our episodes to always have like a pretend patient because then we can have a little better conversation. So let's pretend we have a patient who's maybe in her 45 and she is having some unhappiness with her under eyes. It could be a combination of maybe some laxity, but also some discoloration. What is your like? How do you like to treat that?
It's a great question. And there's no magic bullet, right? So it really kind of depends what the cause is of the hyperpigmentation, for example. So do they have darkening under their eyes because they have actual skin darkening? Is it because of hollowness? Is it a combination of both? Do they have fat that's herniating, that's creating those bags under their eyes? Like you said, do they have some loose skin? So for me, it's a multimodal approach. The baseline of what I start people on, and you can kind of see it in the background over there, is skincare. I think the problem with skincare and the reason people don't trust it is because they're never given a real chance to work properly and not a real regimen. We stay on top of our patients that we start on skincare, and we actually see them almost as if they're post-op patients a month later, 2 months later,
I
to
love
really check
that.
in. Yeah. And what we've noticed is that we've converted people that never used even one thing. Now they're on 6, 7 things, and you'd be shocked with how well it works. I mean, I'll use myself as a candidate. I mean, I'm not saying I'm the smoothest person in the world, but you can see my forehead, there's not a single ounce of toxin in it. This is purely skincare. And if you look at the girls that work here, they're on it too. They also use other things. I'm not pretending like it's only skincare. They use lasers and microneedling and stuff like that. But it's undeniable that the skin quality makes a difference in the surgical results. And then to take it a step further, it's just a question of, do they have volume loss only? So those people, I fat graft their under eyes. Sometimes they need multiple sessions, but because you can only put in so much in one sitting. And the other ones, I'll do a lower blepharoplasty and I'll still fat graft them at the same time. So to me, that fat grafting in the lower bleph is really giving you structural support. You're really filling and you're holding the repair so that they get a nice, long-lasting result. And then the final thing, the best part that I really love about fat grafting is it really is the gift that keeps on giving. So once you hit that 4 to 6 month mark, because of all that new blood supply that's going to that fat, you'll see that the skin quality in that area has drastically improved, and it gets rid of a lot of that crepiness too. So it really is magical. Honestly, I really genuinely am a firm believer that fat grafting, especially in the under eye, is king.
I love fat grafting. Hello, big butts, no lies. I'm a fan of fat grafting anywhere in the body, face, breast, booty, hips, wherever you need it. Um, let's talk about something that is out there right now that I think people are getting confused with. Is this fat grafting or is this what kind of treatment is this? The PRF and the
PRP.
PRP,
Mm-hmm.
the the new one. I lost it.
Alaclay you're talking about? Or,
No, the I I will remember their name and I'll say it. We'll put it in here.
no problem. To me, I love PRP as an adjunct thing. I don't think that it's a primary when you're talking about this area, unless it's someone that really all they have is that darkening and it's not related to hollowness. So I think that's a person you can try it on. They don't really lose much other than time and obviously the monetary aspect of it, but and having a few needles put into your face. But it's a very low risk thing to do. I personally reserve it, especially in that area, for after the fat grafting. So part of my post fat grafting regimen is I like for them to use red light therapy. I think that's a huge one that gets overseen a lot. It helps, again, retain the fat, make sure as much of it can survive, improves the skin elasticity, so you're getting a nicer overall envelope around where you fat grafted. And then those guys I'll also PRP as an adjunct afterwards, but it's never my primary. My issue with PRP and PRF and how it's being marketed as a filler alternative to the areas, it's just untrue. It just doesn't. Yes, it'll look good the day of, but I could also inject water into your under eyes and you'll look great because it'll add volume, but your body immediately absorbs that. So you're getting a very temporary result. I don't understand how it's being sold as a pseudo permanent or it's lasting 6 months to a year. I just personally don't get it. I don't see how that works. So I've never really pushed it as a primary treatment for that area.
So they're, for our listeners, they're not interchangeable. So PRF or the PRP is not interchangeable for fat grafting. If what you need is fat grafting, the solution is fat grafting. Let's talk about red light therapy. So I want to know, how soon do you let your patients, if they're having surgery, how soon do you let them start their red light therapy?
They can walk out of the office and use it as far as I'm concerned. I have no issues with it. We have a medical grade red light therapy that we've brought on that patients go home with. So it's a handheld wand. It's called the Element, if anyone wants to look it up, LMNT. It's made by Alma Lasers. I genuinely love it. It's very low risk. There's no concerns about burning yourself or anything along those lines. Most people will usually wait until the 1 week mark to start using it. There's no real harm from my standpoint. We've sent surgical patients into red light therapy the same day. So why couldn't you do the same thing for something like this? It does get a little warm, so people get concerned, oh, am I burning the fat? But the thing I like about it is that as a fail-safe. So it will shut off in that rare circumstance, which I've never heard of it happening, where it overheats. So it does have a protective mechanism to it as well.
Okay, that's good. I've heard, which is why I wanted to ask you about red light therapy making scars get darker. What's your opinion on that?
I've never, ever seen that happen before.
I'm happy to hear that. Because it was something that came across from somebody who says that this is what happened to her. Her red light therapy made her scars darker.
It's almost not fair to say that it's red light therapy won't do it, because it's like saying, I love alcohol, but really you mean you love tequila. There's a million different types of alcohol you can drink. So I don't know what kind of red light therapy, what wavelength they were using, who was doing it, how they were doing it. There's some user dependence to it. So yeah, could something have happened that caused it? Sure. But usually it's a relatively benign treatment. It's very rare that I've never actually heard anyone say anything negative came out of the red light therapy other than it was maybe a little too subtle. That's the real thing. There's a subtlety to it.
Yeah. So for my listeners, y'all heard not all red light therapy is made equal. They're not all the same. So what you buy on Amazon or wherever you buy it is not the same as what you will get if you walk into a surgeon's office or a cosmetic center and purchase something from them.
Correct.
And I think that's something really important for my listeners to understand, that yes, there's variations. Yes, you can get red light therapy out there, but is it the same as what you're getting over here? Probably not.
I'll take it a step further. It's definitely not, because they don't the companies won't distribute it to everyone. So one thing that we kind of did, and obviously the skincare is one of them, but also silicone creams. I used to never carry it, and because again, it wasn't something I really cared too much about. Everyone was on it. I would send them, go buy it from Amazon. There's no reason for us to hold it for you just to give it to our surgical patients. You could just order it whenever you want. And when we spoke to the reps of actually both companies, they said they don't actually have anyone that should be distributing this stuff online. And they've had a lot of complaints, specifically with the scar cream, that it's actually bootleg versions of the silicone cream. So you're not getting it, and these people are getting really nasty reactions and infections. And the company's like, it's not us. We've purchased the product from Amazon to look at it, and it's different. It's the boxing and stuff is not theirs. So you got to be really careful. It's the reason we brought a lot of the stuff on is because we wanted to eliminate the variables. It's not because I care to sell silicone cream. I would rather not, but it's just so patients feel comfortable that they're getting the real deal as opposed to ordering it from some vague source on Amazon.
Absolutely. Okay, so when we talk about facial fat grafting, something that always ends up in my inbox is it true that the different methods of processing the fat affects the result of how much the fat sticks?
1000% yes. Not even a question. It makes an absolute difference how you process it. So, personally, I do nano fat grafting. I use this device called the Tulip Harvester. For anyone that's wondering what it is, essentially, it just helps you remove the fat, usually from the abdomen, in as least traumatic a way as possible. And it comes with multiple fillers. So you're gradually going from this globular, thick fat to essentially a paste filler by the end of it. And the reason that you get 90+% retention with that kind of fat, and especially in the face, is because the more contact and surface area the fat has with the surrounding blood supply, the more likely it is to survive. It's the reason that you see a huge loss in things like the butt, where people will lose 20, 30%, and even in breast, right? That's why we talk to patients about, hey, you are going to significantly lose 20, 30% of this volume, so don't get set on what it looks like immediately. When it comes to face, assuming they follow the instructions afterwards, and they are getting what they're getting. They might lose a few percent here and there, but really you get to see the results on table. So yes, so it does matter. The amount of time it takes you from the time of harvesting to inject it matters. The way you harvest it, the way you process it. There are other ways that I will say are also less traumatic, but the problem with them that I find is that it takes way too long to get from the point of harvesting to the point of injection. And my concern is, are you killing those fat cells in between because they're exposed for too long? So I've switched over to the Tulip. It's worked really well for me. I haven't had any issues yet in terms of retention. So I'm definitely a big fan of it.
Okay, so you heard that, guys. It does matter. The fat processing does matter. So if you're one of my skinny girls who doesn't have a lot of fat to give and you just got one shot, let's make sure that we're going to somebody who does a lot of fat transfer, who can make that fat.
100%. And, one of the things, definitely when you're talking about body and you're talking about liposuction, when we're putting in that tumescent to harvest the fat, the temptation is to put the tumescent in and immediately liposuction. And the reality of it is, if you have a lot of fat to work with, it's not that big of a deal. You probably can get away with it. You will lose a little bit more blood. It's not ideal. I don't like it regardless. But if you you just wait, just don't touch. Let the thing sit, let it work. You get high quality fat. You have very little blood loss. The patient recovery with bruising and swelling is less. It really maximizes the results. And I think if you apply that same concept to facial fat grafting, although we're talking about a very small amount of fat, why wouldn't you maximize the results if you can? Especially when you're talking about the face, something that's going to be a walking billboard for you. I think that's where you should take your time the most and make sure the fat survives. No one wants lumpy bumpiness in their face, and they don't want half their face to look great and the other half to look deflated. So
Absolutely. I think it's you talked about something really important just now that if I want to add a little bit to, which is you said put the tumescent in and wait, which for my listeners, y'all don't know that being able to say, hey, like, let's wait for this to work is a luxury, because these surgery centers that are pop, 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 one after another, you don't have time to wait. you gotta go. Hurry up. Where the clock is ticking, and we have to get the next patient in here. And so, for our listeners who don't know, they don't know this, and this is why I talk about these things, these little small nuances that you don't, as a listener who doesn't know anything about the plastic surgery industry, y'all miss it, but it's something that is actually very, very important.
Very important. It's one of the most common things we get asked when we're talking about how long the surgery takes. Forget about fat grafting because it's usually done in the office when we're talking about facial fat grafting. So you don't have to worry so much about anesthesia and facility and all those things. There's obviously, time constraint. You don't want it to take 3 hours, but when it comes to the rest of the body, they say, well, so and so told me it's only going to take half an hour to do 360 lipo. The reality of it is, if you go by the book, you're supposed to wait minimum 20 minutes for the two methods away. Now, I'll be honest, 99+% of surgeons are not waiting 20 minutes. That's just never going to happen. It's the reality of it. It's just not going to happen. But 10 minutes, 15 minutes to really make sure. My end goal is I want to see the skin turn white. That's how I really know that epinephrine in there has done its job, shrunk the blood vessels, and then I know I'm clear to go. So that's kind of how I base it, because then I know it's really kicked in. And I always, if there's other surgeries we're doing at the same time, I'm always tumescing first, working on the other body part, then I'll come back, and it's already had time to sit for half an hour or so, and you should see the quality of the fat that comes out. So when someone tells you it takes 20 minutes to do liposuction and this and that, yeah, if you don't wait, sure, it could take 20. You could do it in 10 minutes if you wanted to, but it's a question of doing it right and maximizing the results and avoiding things like fibrosis, irregularities in contour, prolonged swelling. All these things are related to that. You'll look great when you walk out, but talk to me how you look a week later when everything looks beaten up, and 6 months later when your skin has that rippling in it because they were overly aggressive on and didn't wait to do those things.
You touched on something. So I was just talking about this on my Instagram, actually. About which I can talk to you about it because you do body surgery as well. You're not just a facial surgeon, you do body surgery as well. And
Correct.
Off camera, we were talking about breast and lipo and those types of things. So I can talk to you about it because you understand. You understand what I'm saying. But what a lot of women don't know about liposuction is that they want to be sucked dry. Take it all. Take all of it. Every single drop. But what y'all don't realize is there needs to be a little bit left, or else what? Yeah. Tell them.
So this is a very sensitive topic for me. So it comes up a lot. People always ask about etching and stuff like that. So there's two layers of fat. You got your superficial fat, and then you got the deeper fat. The deeper fat, to me, is the right fat to remove. Remove it, you get a nice, safe, clean contour, this and that. You want, like you said, that thin layer of that superficial fat to be there. A, because it's great blood supply to the skin. It gives you good quality. You can see someone that was over liposuction, their skin feels and looks awful and has this and then you see all those irregularities as well, right? Because they've removed, and now your skin is essentially stuck down to fascia or muscle, if you essentially want to think of it like that. It's just a horrendous way to do liposuction, and really doesn't get you nice results. I understand the appeal of it to remove all the fat sounds nice, but the same way we're adding fat into things, keeping the fat that's naturally there will help maintain beautiful results. And on that same token is why I hate abdominal etching, because abdominal etching, all you're really doing is leaving pockets of fat behind and then over liposuctioning around it. So yeah, they look great. I've seen some really unbelievable etching results, and it's not to knock the guys that are doing it. It's not my personal thing that I enjoy, but what happens to that fat and that skin 5, 10, 20 years later, when that continues to sag, all of a sudden you have very saggy looking abs that are made of fat and no longer does it look like muscle anymore. It makes sense when you're younger. It will definitely not make sense when you're older. And the only way to really fix it, A, is either tummy tuck and aggressively overly liposuctioning them later on in life, which again is not.
I am. I like ab etching, but on men, not on my girls. On my girls, you know what? Please, let's not. Because have y'all seen some of these videos circulating of like, I'm sure y'all have seen it. It's a woman walking through a nightclub who had ab etching, but probably did not change her dietary habits after surgery, didn't, keep up with exercise to maintain her results, and ultimately gained a little bit of weight after surgery. And these six pack abs just look like rolls, just,
Yep.
those Hawaiian rolls? They look like Hawaiian rolls.
Not as tasty.
Not as tasty. And when you're having your surgery, I like to tell my girls when we're thinking about having plastic surgery, it's not just right now. This is a permanent decision and this is going to be for the rest of your life. How is this going to look when you're 50? How is this going to look when you're 60? Especially for my fat transfer girls who want very extra, a lot of volume. Like, how is this going to look in 10 years, in 20 years? And that's always a question I like to leave out there for them.
I love that, and I agree. And to me, it amazes me when patients come in and we've spent time talking to them for consultation, 10, 15, sometimes half an hour, and they'll say, "Oh, we've seen a few other surgeons, and they spent no more than 3 minutes." I don't understand how you can have a full conversation about the risks, the benefits, the outcomes, the pre and post op care in 3 minutes. It's just not possible. You have to be bypassing some of that discussion. And I think that's what contributes to patient dissatisfaction. I think if they don't know what they're getting into, I could sell you on the dream the second you walk in. I'm going to make your waistline look great, and we're going to snatch everything. We're going to use all the hot words. You're going to be sculpted. I love those words. Don't get me wrong, but it's not enough to just give buzzwords and then walk out of the room and say, "We'll see you at the day of surgery." There's no patient that we operate on that we don't also see one more time minimum before surgery. So because everyone forgets that first consultation. Everyone forgets everything you talked about. So to me, it's a minimum half an hour to an hour conversation all in at some point, whether you split it up into two or one. And I think we've succeeded very well with that plan because patients know what they're getting. They're happy. They feel informed. They feel empowered. They've gotten to ask you questions. They didn't ask, the and I'll say the people that work here are unbelievable. They can answer the questions probably better than me at this point. But at the end of the day, if you're the one operating on them, you should have the control over the information that gets conveyed to the patient to make sure that they know exactly what they're getting in and what they're getting out of the surgery.
Absolutely. I could not agree with that more. I know my girls, I do discovery calls, so I get to hear stories of women who are either before surgery or right after surgery, or maybe they found me in their post-op period. And some of the nightmares I hear of not meeting the surgeon until the morning of, getting the surgeon switched the morning of, and the procedure, just these things that I'm like, is this really happening? Are you, and here down the street, this is really happening, and it is, and it's shocking when the patients go home and or not even go home right away. They're getting kicked out of surgery centers, being like, hurry up, you gotta go. And then they're home realizing, what the just happened? What did I do to myself? How am I going to recover this? And this recovery is a lot more than what I thought it was going to be. And those are the things that, to me, I do not want you to walk into surgery not knowing what you're going to walk into. And that's why I have my show. Like, I launched my show to educate women on the pre and the post, the surgery and the after, not just finding the surgeon and having the surgery. That's just half the job. The rest of it, we still got to do the rest.
Yeah, I couldn't agree more. And I think that surgical center side of it is important, right? Where are you operating? We use Pro Health or Optum. It's basically essentially a mini hospital, full nursing staff, full anesthesia, full complement of anything and everything you could possibly need. And I'll tell you this, they don't skimp on any of the stuff. So you know everything is nothing is expired. We're not using any back alley things there. God forbid there's an emergency and you need extra pair of hands. You have three other anesthesiologists that can come in. You have all these CRNAs. You have PAs, NPs. I mean, go down the line, and you hope that you never have to use them. But the reality of his surgery does carry a risk, and you never know what's going to happen. Maybe it was hard to get the breathing tube in. Maybe the patient had an adverse reaction to some medication you injected. I mean, to say that there's no risk is just a blatant lie to our patients, and I think that's again another disservice. Every time I talk to them, I talk about those risks, and they're like, we've gone on multiple consultations and not once has anyone even mentioned half of what you're talking about, let alone any risk at all. They thought it was like, oh, just a quick in and out. So I think that makes a huge difference. And again, we have a patient, that's kind of a classic story in our office, that she went outside the country, and we won't say what country because it doesn't really matter, but she basically met the surgeon the day of. She said she met the anesthesiologist while she was sitting on a toilet in a bathroom while they were placing an IV in. She doesn't remember any of what happened after that. And the next thing she remembers, she woke up in a hotel room on a bed by herself with no one around her, like within an hour of her surgery.
Oh my God.
I told her she's lucky they didn't remove a kidney or anything else, because luckily all she did, I hate to say that it's only liposuction, but the scars from liposuction are too small to remove a kidney or a lung or whatever they could possibly pull out from them. But she got butchered, is the reality of it. She needs a major reconstructive surgery, and it's sad. You're saving money on it. I get it that they're charging $1,000 all you can eat buffet in these countries, but they're making their money back sometimes on the organs they're harvesting are very expensive on the black market, and they're cutting corners. I've removed implants that were blatantly expired by 20 years, and it's not even a question because they had their breast augmentation 5 years ago. The company doesn't even exist anymore, so it's not that I'm guessing that they were expired. I didn't even recognize the company name. That's how old it was, and I had to look it up. And it was a company that was bought out 20 years ago. So the implants were taken off the shelf 20 years ago. But that's how they're keeping the costs low, right? Implants are not cheap. Surgery, especially aesthetic surgery, is not cheap. If it's cheap, there's something wrong happening or something is getting cut. It's just not possible to do it at those price points and to sustain it at those price points and without there being something, I don't want to say illegal, but not kosher, right? That something, they're cutting corners somewhere with those types of surgeries.
I'm going to say that it's illegal because I have had, like, for example, in my career, I worked with top surgeons, top board certified plastic surgeons, and top practices where everything was right where it was supposed to be. Patients were treated like with the utmost respect. We did everything we possibly could to make sure that our patients were taken care of, informed. Everything was top of the line. So then to go from that experience and then come out into the real world and hear about women who are not meeting the surgeon until the morning of, who are getting the surgery switched on them last minute as they're getting put in under, getting kicked out of surgical facilities before their ride even gets there, waking up with wrong procedures done to them. Maybe they went in for a tummy tuck and they got a breast reduction. Some crazy stuff that you're like, how is this place still up and running? And unfortunately, what the general public doesn't know is that they close and they open under different names because it's not really a surgeon. It's a company that hires surgeons to do surgery. The company does all of this marketing, which is how y'all found them on
Mhm.
Instagram and Facebook groups. That's how y'all find them, through all of their marketing that they're doing. But the surgeons that are doing the surgery sometimes are not board certified plastic surgeons. Sometimes they're uh, surgeons in other countries
Yep.
who come and they're like surgical assistants, but they're actually the ones doing the surgery. There's so many illegal things happening. I'm gonna go as far as saying a lot of the stuff that's happening is illegal.
Look, you'll get a lot also of, and this is really, I'm trying not to knock the other specialties, but when someone's saying they're a cosmetic surgeon, there's no plastic surgeon on the planet that refers to them solely as a cosmetic surgeon. So to me, again, that's something, and don't get me wrong, there are good cosmetic surgeons out there, but that's one thing that people often bring up. Well, so and so up the block is, doing it for this and that, and I'm like, well, you're comparing apples and oranges. Yes, how about you could drive a Hyundai and you can drive a Ferrari? And again, that's making it sound like I'm
You're like, I'm the
talking,
Ferrari.
but they'll both get you point A to B, right? But do you want the person that spent 20 years to do it, or do you want the person that spent 4 or 5 years to do it? If you're asking me, give me the 20-year all day, every day. And yes, I'm biased, but I don't care. It's not a problem when everything goes well. It's a problem when there's a complication. Can the person that's operating, do you trust them to be able to handle the complications? Because inevitably, someone will have one. And again, like we said before, one of my mentors always used to say to me is like, anyone that says they don't have a complication is either lying or not operating enough. And it's just physically impossible. The numbers point that one out of every X amount of people is going to have X complication. It may not be a major one. You hope that it's, your complications are never these. Yeah, it's always usually a smaller thing, but that's another side of it, right? What are their complications, right? How many times are they getting these massive complications that are causing major deformities and things like that? Is it a one-off? Or can you go and you do your research and you see they have 30 patients in the last year that are complaining about the same thing? So that to me is quality control, right? You can follow, we use Instagram. I think Instagram's a great way to find your surgeon, to get a little bit of taste of them. But it's not just Instagram. You have to use your instincts, your gut when you're talking to them. You have to feel out, do your research, go see what they've done, see their training, go deep dive into it. This is a big thing you're trusting us with, right? Make sure you know who you're talking to and not just assuming, hey, they're a cosmetic surgeon, they've operated on so-and-so and this and that. They probably are good, right? Maybe they are good, but make sure you know that for yourself and you know that you didn't get information from someone that may or may not be someone related to them or something like that. Make sure it's people that are unbiased in how they're giving you their results. And I think that's where Google reviews, I think, is the equalizer. Yeah, you can fudge them. And, I've heard of people paying people to drop bad reviews and stuff like that and things along those lines. But I think in general, you can get a taste of what you're getting through them, right? There's always going to be one or two patients here and there.
Can't
along
make
the lines.
everybody happy.
Yeah, it's going to happen. At the end of the day, it is what it is. You just have to understand that. But if the overwhelming majority of people are saying, this was an excellent experience, I really enjoyed everything about it, everyone is using the same words, listen to my concerns, achieve the goals that I was looking for, those are what I think people should be looking after, right? Are they getting consistent results that people are consistently happy about, right?
So now we've heard a lot about you, Dr. Kashan, and your thoughts on fat grafting and those types of things. I'd like to learn a little bit more about you, about how did you decide to become a plastic surgeon?
Yeah, so it's a great question. I come from a family that's heavily in medicine. My father's a surgeon. My uncles are all surgeons, cousins, brother, go down the line of surgeons in the family. And most people assume, oh, well, because of that, that's why you wanted to do it. My father was actually very much open to us doing whatever we wanted. I think the passion for it came from watching him and just watching how much he enjoyed it and how fulfilled he was. There's obvious stress of being in medicine and definitely being a surgeon, but you can see that every surgeon that complains on the same thing in the same sentence will say, I can't imagine myself doing anything else. And I think that has to do with the fact that we do have exciting lifestyles. We do, show up to work and every day is a different day. We're operating on a different body part. So to me, I knew surgery was a heavy consideration. It wasn't always plastic surgery. So I originally trained general surgery. I did my 5-year residency at Downstate, which I loved. And as a result, I heavily entertained the idea of doing breast oncology, so doing mastectomies and tumors and things along those lines. And then for a while, I was also considering doing cardiothoracic surgery, so open heart surgery, lung surgery. The reason I kind of realized that it wasn't the right thing for me is because I knew I loved operating on the lungs. I didn't love operating on the heart. So why would I go into something that I don't like 50% of the field? I need to be in something that I really enjoy doing it. And that's kind of plastic surgery. I had a lot of great mentors. I got to give them credit. They really did make it such an enjoyable process for me and showed me just how great and how a lot of people see the cosmetic side, but reality of it is we do craniofacial surgery, reconstructive surgery, hand surgery, pediatric surgery, cleft lips, cleft palates. It's endless what you can do. We obviously funnel and focus on what we enjoy doing, but there's nothing to say you can't do all of these things if you really wanted to. So as a result, it kind of just grew over time. I'd love to say there was this aha moment, this is what I want to do, and let's do it. But it was years before I really made that decision. And so any of the students out there that think like, hey, I know I want to do X, Y, and Z, I always tell them the same thing. Yes, focus on it if you know that's what you want, but use your time in medical school and your rotations to make sure for a fact you don't want to do the other things, because you'll never come back to it. You may never want to do cardiology, but use that rotation to really learn that stuff, because it will come back. You will always have that knowledge, that source where you can go and, hey, oh, maybe this is what this was talking about 5 years ago. And you might save yourself from operating on someone you shouldn't have. So take all the rotation seriously, even if it's something you don't want to do.
That's a great piece of advice. I think that's a really great piece of advice. I don't think we could end this episode on a better note. So, Dr. Kashan, if my girls want to come find you, how can they find you?
So we are located in Roslyn and Long Island, which is in New York. They can either call the office. We can tag the office number if that's easier, or follow us on Instagram and message us, David Kashan, MD. Those are really the two main ones. Obviously, if anyone has any questions and wants to ask them on the post in the comments, we'll try to get to all of them. And honestly, this was a great experience. I really enjoyed this.
Oh, thank you so much. I enjoyed having you on the show. And with that, you guys, I'll see y'all next week. Thinking about plastic surgery, but you don't know where to start? I've got you. With 18 years in the industry and experience working with top board-certified plastic surgeons, I help women like you make informed and confident decisions. Whether you need help choosing a surgeon, planning your recovery, or understanding what to expect, I've got your back. Skip the guesswork and get expert guidance by booking a call with me today. That's a wrap for this episode of Big Butts No Lies. If you found this episode helpful, do me a favor and subscribe, leave a review, and share it with a friend who's considering plastic surgery. Until next time, stay confident, stay informed, and remember, big butts don't lie.